Hello everyone, we are from small group discussion B9 and we will present our student project about cochlear implant. These are our group members and my name is Krisantal Dramdarjo with student number of 20025111230. And now I'm going to explain about the introduction of our student projects. So Indonesia is the fourth country with the highest prevalence of deafness in Southeast Asia. So deafness and hearing loss are a situation that requires a lot of urgency. There are many factors that can cause deafness or hearing loss. There are also several therapies to help people that suffer hearing loss. Cochlear implant is one of the therapies that can be given. Cochlear implant consists of an external device that receives and processes sound, and an internal device that transmits signal that will stimulate the cochlear nerve, which will direct the signal to the brain.
My name is Dave Christopher Panahutu with the class of student number 107, and I will continue to talk about the program formulation, objective, and benefits of our student project. The program formulation of our student project is: what is the definition of cochlear implant? What are the classification of cochlear implant? What are the indication of cochlear implant? What are the implant techniques that can be used in cochlear implant? What is the implant evolution of cochlear implant? What are the complications of cochlear implant? And what are the special consideration of cochlear implant? The objective of our student project is correlated with the problem formulation, to know the definition, the classification, the indication, the implant techniques that can be used, the implant evaluation, the complication, and the special consideration of cochlear implant. And the last is the benefit of our student project. The theoretical benefit is to write the writing this paper is expected to be means channeling the written to describe the cochlear implant. And the practical benefit, the writing encouraging the process of writing a scientific paper and expanding knowledge of cochlear implant, and for society giving an idea how to do cochlear implant. That's all from me. Thank you.
Hello everyone, my name is Joshua Francisco Sofian with the student number 229, and today I will explain about the definition of cochlear implant. So cochlear implant is a device which is used to enhance auditory input. Cochlear implant works by stimulating the cochlear nerve, which is also a part of the cranial nerves of the body. Therefore, by enhancing the auditory input, cochlear implants have been used in hearing loss treatment. Thank you. My friend will take it from here.
Hello, my name is Nadia Zalfakila with the last three-digit number 079, and I would like to deliver the classification of implantation. So the first thing we need to know is there's two types of hearing loss, such as the first one is unilateral hearing loss, which is a profound sensorineural hearing loss in one ear, with the common causes like shown. This usually treated by a CROS or contralateral routing of signal hearing aid, or also the osseointegrated hearing implant. But with cochlear implantation, the device may offer some special hearing as well as the hearing on the deaf side. The second one is bilateral hearing loss, which is a hearing loss in the both ears, and this usually treated with cochlear implantation, because several studies have shown that patients with bilateral cochlear implantation do significantly better. But what is cochlear implantation? So cochlear implant is a sophisticated electronic device that can enable someone who is profoundly deaf or very hard of hearing sound, with an exterior piece of the implant rests behind the ear, while a second portion is surgically inserted beneath the skin. What we need to know is cochlear implantation cannot restore natural hearing. However, depending on the user, they may aid with word recognition and improve speech comprehension even when talking on the phone. That's all for me. Thank you.
My name is Indah Mutia and I'm going to continue to the indication. Cochlear implant is indicated when a keen hearing loss comes cause to deafness is diagnosed and cannot be treated by other auditory rehabilitation approach, accompanied by fulfilling some preoperative diagnostic conditions to proceed to the surgical step. There's a different type of indication between children and adults, considering different diagnostic scopes, but the earlier the implant is done, the better the result is, no matter which age group they are in. Pediatric cochlear implant indication is stricter. This includes monitoring of each ear performance individually, profound retarded hearing loss with thresholds more than 90 decibels in children than 2 years, and suffer to profound hearing loss starting at 70 threshold is age 2 until 17. Asymmetric hearing loss must be accompanied by poor word and speech understanding. Residual hearing in the ear that has implant is not a contraindication for implant use. Another indication of profound bilateral and sensorineural hearing loss, and lastly, inner ear cochlear anomalies are not a contraindication for cochlear implant, but cochlear nerve aplasia is an absolute contraindication. That's all from me. The next will be continued by my college. Thank you.
Hello everyone, my name is Ida Bagusari Basana with my number is 184. So today I'm going to talk about the indications of cochlear implant in the adult system. So adult cochlear implant indications in the adult is established mainly on the sentence recognition performance less than 50% with a profound level of hearing loss that has failed from conventional hearing application methods, including hearing aids. The indications for acquired deafness after knowing language are sound pressures threshold more than 65 decibel. Because this is the normal sound pressure level for conventional speech, more than this will disrupt normal life and 60% performance with hearing aids. And if the person cannot make the telephone calls with hearing aids, cochlear implant is highly advised. Thank you.
Hello everyone, my name is Sinta Miguel Marcela and my student ID number is 070, and today I'd like to be describing about the implant technique. There are two kinds of technique here. As we can see here, there's a classical technique and there's a varia technique. Classical technique usually common uses use the facial recess or posterior tympanotomy approach. Here's the pros and cons as you can see shown in the video. And there's a varia technique. It uses the endural road for transcanal cochleostomy or round window approach, and a tunnel is drilled parallel to posterior canal wall through facial recess for passing electrodes through it to middle ear without doing mastoidectomy. There's a pros and cons also, and here's actually the step-by-step how the full insertions of the electrode array was confirmed. Begin with a limited post-auricular incisions 3 cm in length, and as you can see in the video. Probably that's all from me, and thank you.
Hello everyone, my name is Cochlear and I'm going to continue the presentation about the cochlear implant evaluation. So, a thorough audiologic and medical workup is used to determine a candidate's suitability for a cochlear implant. The FDA has recently increased the requirement for implant eligibility, thus allowing individuals as young as 1 year old and those who may still have some residual low-frequency hearing to qualify. Imaging is obtained in addition to preoperative auditory testing such as CT scan of the temporal bone or the MRI of the brain. And the dangers, advantages, objectives, and expectations of the cochlear implant surgery should be discussed in advance with patients or the parents of children, as well as the significance of post-implantation rehabilitation and programming. I think that's all from me. The next presentation will be continued by my friend. Thank you.
Hello, my name is Darren. I will continue the presentation on the complications of cochlear implant. So certain anatomical variations in children below 1 year old may cause higher risk of bleeding intraoperatively. Next, damage to the facial nerve through this procedure is also possible, where facial nerve palsy may occur due to inflammation of nerve, direct pressure on the nerve by the electrode that is implanted, or infection. Another complication is post-auricular swelling, which is common, and usually the hematome occurs 1 to 2 days after the procedure. Another complication that clinicians are usually causes of is surgical site infection. Other minor complications include immediate post-auricular pain and transient vertigo. Okay, a rare complication that may occur is post-implantation facial nerve stimulation, where the electric current produced by the electrode causes stimulation in the adjacent facial nerve. In contrast to minor complications, one of the most frequent complications is taste disturbance due to damage to the chordae tympani nerve. And lastly, meningitis may also occur as a potentially fatal complications. That is all from me about the complication of cochlear implantation. Thank you.
Hello, good morning, good afternoon, and good evening, doctors. My name is Putri Yudhistira Kawardana with 3 last digit student ID number 098, and I will continue the presentation. So, every procedure has consideration before it applied on patient, especially invasive procedure like cochlear implantation. There are consideration for this procedure in several population, and in children under 12 months, contraindications are including long healing time and high device exposure due to skull volume and thin skin flap. Anatomical reasoning, having injury on nervus facialis, nervus cochlearis absent, etc. There is no significant gap on prevalence of complication in children under 12 months old and 12 until 18 months old, but there is high readmission even due to surgical site infection. We should know about the first 3 years of life are crucial period for the children to learn auditory stimulation, also speech and language performance as children is learning by mimicking the others. So individualized consideration in each patient are important. Children under 12 months old shows mild to significant advantage. And to evaluate this, we can use CAP test, parent report questionnaire, ITMAIS, little ears, which also explain that earlier cochlear implantation gives better performance than the latters. And if children have developmental delays, it can slow down the procedure and also delays the diagnosis of their auditory impairment. I think that's enough from me. The next presentation will be carried out by my friend. Thank you.
Hello, my name is Azamir Salfadila with registration ID number 094. I will continue the presentation about another special consideration in surgery. The second one is cochlear malformation. This condition happens in 20 until 30% of infants with congenital hearing loss. The classification of cochlear malformation divided into 5 types by Jackler et al. Based on embryology. Then refined to compare the difference between incomplete precision type 1 and 2. Management of cochlear implants in cochlear malformation shall be preceded by evaluation using imaging studies before surgery, such as CT scan and MRI. Moreover, there are complications that can be happen, such as CSF leakage and facial nerve injury. The third one is cochlear ossificans. The most common cause of cochlear ossificans is meningitis and advanced otosclerosis. Proper strategy and planning are required since this condition can limit electrode insertion. To overcome this, several surgical techniques can be performed, such as posterior tympanostomy, and in addition, the electrode insertion method with scala vestibuli insertion and retrograde electrode insertion show a good result. That's all from me. The presentation will be continued with my friend. Thank you.
Hello, my name is Shakli Septiana Chandra with three last digit of student number 129. Now I will conclude our presentation, cochlear implant. Okay, cochlear implant is an electronic device to enhance hearing that consists of 2 devices. The external takes in and analyzes sound, and an internal device transmits impulse to stimulate the auditory nerve, which then sends the signal to brain. And then unilateral versus bilateral hearing loss. Unilateral hearing loss may be treated with CROS or contralateral routing of signal, while bilateral hearing loss have the options of 2 hearing aids or 1 fitted aids. The indications for children are about the communication, development, and the advantages of cochlear implant, while for adults, is sentence recognition ability of less than 50% and hearing amplification treatment failure. An absolute contraindication for pediatric cochlear implantation is cochlear nerve aplasia. The complications are intraoperative bleeding in children less than 1 year old because of their anatomical, facial nerve palsy, taste disturbances, infection, and etc. Special considerations for cochlear implantation surgery are children less than 12 months, cochlear malformation, and cochlear ossificans. This is our bibliography. And we would like to say thank you, especially for our facilitator and for our evaluator for guiding us this student project cochlear implant. The small group discussions B9 look forward to the input, criticism, and suggestions that will lead to the improvement of these student projects. Once again, thank you.